and online marketing so that they can have a stronger impact, make more money, and enjoy a more balance, cut that, and enjoy more balance in their lives. Tina, welcome to the show.
Thank you. I'm honored to be here.
So what are we going to talk about today?
Well, I was hoping that I could chat with you about exercise and strength training for overall wellness, anti-aging, and all those things. I know I feel like I'm beating a dead horse on this topic, but I'm such a nerd about it. And I keep digging up more and more research that shows us that exercise really is the panacea for everything that ails us.
It really is. And myself having a exercise science background, what I learned in school in the late 80s, early 90s, has changed dramatically. So I love having folks on the show similar to ourselves that look to dive in deeper and try and nuance and biohack the information that's out there. So I think this is a great topic. I'm ready to roll. Just for our audience, Dr. Tina, can you give people a little bit more a deeper look into your background?
Sure. So like you said, I'm a naturopathic physician and a chiropractor. My background predominantly in practice has been regenerative injection therapy. So I was doing treatments like prolotherapy and platelet-rich plasma long before it was sexy, long before everybody recently decided to jump on the bandwagon and realize it was quite a impactful therapy. So I'm really at heart, I'm a chiropractor. I'm kind of a meathead. I love lifting weights. I love throwing heavy weights around. When I finally discovered strength training, I was 40 years old when I started lifting weights. And before that, I had off and on been athletic. And I have a pretty strong rehab background. So the minute I started lifting weights, I started diving into the research because, like I said, I'm a super nerd. And it's kind of mind-blowing what muscle does for our bodies, what exercise in general does for our bodies. And I think it's so multifaceted. And I don't think we have even touched the tip of the iceberg on it. I think we're going to realize more and more in the next decade just how incredibly impactful it is that human beings move their bodies. So that's why I geek out about it.
That's awesome. And you hit the nail right on the head is that human beings need to move. And we are in a society today where we're moving less and less. And when you apply weight training, functional weight training, smart weight training to movement, you can really do anything you put your mind to.
It's kind of a superpower. Being
Yeah.
strong and having muscle mass really is. And for those who have not yet experienced it, they don't know what they're missing. And it takes years. Like it took me years to put a slab of muscle on my body. And that's what I tell my patients. I'm like, you just got to put a slab of muscle on your body. And that's it. Like in its simplest sense, this isn't about aesthetics. This isn't about weight loss. This isn't about fat loss. This isn't about any of those things. It's literally just like add and build that organ system because we need it for so many different things. And, I didn't really understand that growing up. I was a child of the 80s. So it was cardio, and jazzercise and those funny videos that my mom would play where everybody was hopping around in like shiny spandex. And I thought that was exercise and I hated it. So I rebelled and it turned into like a skinny, first off, I was a gymnast as a kid. And then as a teenager, I was like, I'm just going to chain smoke and listen to punk rock music and not exercise at all. And I ended up really, really thin and really sickly, which was all the rage back then in the early 90s, like be as thin as possible. And I ended up with chronic autoimmune issues and chronic illness. And I got my way through my 20s somehow. In my 30s, I dove into Pilates and running, which I love Pilates. The running part probably wasn't a great idea, but it served its purpose. And then somewhere around 40, I had been in practice for a while. All of my patients at that point were injection therapy patients. And the one thing I noticed, beyond what they were eating, beyond what their hormonal status was, beyond their sleep patterns, beyond all those things that are so critical to overall health, the one thing that consistently played a role in whether people got better or not from my treatments was whether they had muscle mass. They could be eating the crappiest diet in the world, but if they had good muscle mass, They tended to respond really well. So that was convincing enough for me. And I went to the gym. I interviewed several strength and conditioning coaches. I found one I liked, and I was like, look, I was actually underweight at the time. I was about 20 pounds less than I am now. And I was like, I just want to learn how to deadlift and squat. I want the most muscle possible.
Sure. There you go.
That was the beginning. And since then, it's just been really, really eye-opening.
So I was going to ask you how you at 40 decided to weight train, but you already answered that. But so you're doing this for yourself. You obviously see amazing results. You've got a ready population that you are able to pass your wisdom to. Dive into that for me. What does that look like for yourself, and especially for women, because we know stereotypically women, as they get older, men too, but to a much greater extent, women lose a lot of their muscle mass. And talk to me about this.
Yeah, so we lose a huge percentage of muscle mass per decade, starting in our 30s and 40s, women in particular. And what I was seeing in practice was women would come in with head to toe pain, wanting injection therapy. And I'm like, I don't even know where to start, lady. They were so deconditioned. They would lay down on the table. And so they were happy because they were still wearing the same pair of jeans, the same size as they did in high school. But at this point, all of that muscle mass had been replaced by fatty infiltrate. Your muscles literally start to fill up with fat, and you become more fat than muscle, but you still look thin. So people think, oh, it's like that skinny fat term, yes, which is thin on the outside, fat on the inside. Metabolically, you're actually in a worse situation than somebody who's heavier on the outside and metabolically unsound. So I started seeing these chronic pain patients, and I was like, we just got to get you moving. We got to get those joints moving. And half the time they didn't need injections. Once they started eating enough and moving enough, the pain really resolved itself. And so it's called sarcopenia. It's poverty of the flesh. That's the Greek. It's Greek for poverty of the flesh. And it's literally wasting. And when you waste and waste and waste for decades until eventually you're so frail and you're so fragile that they literally call it frailty syndrome, that you fall and break a hip, or you break a hip and fall. And as we know, that's the kiss of death. So how do we avoid that is really what I was after. And I just kind of wanted to rock my way through menopause. That was my main goal, was like, I just want to get through this with happy, healthy hormones, a good libido. I want to be able to do all the things I want to do. I don't want to slow down. I want to hike the Great Wall of China at 80 if I want to. And so the quickest route to that for me was strength training. It's also it's a great exercise for those of us who don't have a lot of time, because it's succinct. So you can get it done in 20 to 40 minutes. You can get a good workout in, maybe a little longer if I've just turned 46 and I have to warm up for about 20 minutes. I don't get to just jump right in, but sure. I'm in and out of the gym. It's very efficient. It's very impactful. It helps us do all kinds of things that I didn't even realize, which I can go into in a minute. But I really think that we have to get away as women. We have to get away from this concern that we're going to get bulky or that we're going to look a certain way. I think really women who strength train, who are careful about their carbohydrate intake, because I do believe we have to be more watchful of that as we age. Those women end up just looking sexy and strong. They don't end up looking bulky or bloated, or that takes a lot of testosterone. and on that tip, we need testosterone to feel well as we go into our 40s and our 50s, and strength training is one way to upregulate our own natural testosterone. So it's pretty win-win all around.
Yeah, and it's really interesting that you hit on that point. My wife is a cancer survivor. She had a radical hysterectomy. 40 at 40, and now she's 52. What was missing? It was a dramatic onset of menopause, but the hormones for a woman are kind of like, I would say, kind of like a margarita. You got 2 parts tequila, 1 part triple sec, and a quarter Cointreau. And it's the same thing for a woman's hormones. When you look at it, it is estrogen, progesterone, and testosterone. And women need that testosterone. And by weight training, exactly what you're saying, that is going to help the body really stay healthy and be lean into old age.
Oh, absolutely. And I just did a webinar about women and testosterone, and what I found out was shocking. We actually have 3 times as much testosterone in our body as we do estrogen.
Ah.
And which, I love your margarita analogy, but that made me change the recipe a little. It's pretty critical. And it really, for stamina, for pain, especially for pain relief, I had no idea the impact it had on pain until I really dove in. And you think I would know, having treated people over a decade who were in pain. I knew it about men, but I did not put it together for women how critically important testosterone was to reduce their pain. Particularly, middle-aged women often will present with hip pain, bilateral sacroiliac pain, bilateral trochanter pain. To me, honestly, after all the research, I've lived it, and after diving into the research, I really think A, it's lack of conditioning and strong gluteal muscles, and B, it's a hormonal issue. So, these are things to consider. We don't want to become decrepit. We don't want to end up in wheelchairs. We don't want to end up with a broken hip. We certainly want a healthy libido. That's another big, huge win. It does great things for your pelvic floor. It does great things to get blood in all the right places. Exercise in general, but particularly strength training, can do wonderful things for that pelvic floor, so that you can still have good, healthy intercourse and feel it. Women will start to lose sensation as they get older, not just because of hormones, but because of actual deconditioning of those muscles.
Absolutely. Let's dive into when you say weight training. What are you looking at? Take me through somebody that you work with, that is a female, because everybody's got different values, everybody has different goals and objectives. So take me through somebody who comes in, female, deconditioned, that really wants more out of life.
So the first thing to consider is just basic human movement patterns, like hip hinges, squats, movements that we do as human beings. So if you look at indigenous cultures, and you look at cultures that do a lot of agriculture and they're out in the fields, they tend to have really good hip hinge technique, really good squat technique, and that protects our back as well. That keeps our spine happy. So making sure that they have control over their movement patterns first, and then you load them with weight. They don't get to pick up the weight until they actually can show control of those movement patterns. And sometimes that takes months and months and months, if not longer, to be honest with you. Like, it took me probably 9 months to figure out how to deadlift correctly before my coach finally looked at me and said, "Good job." So I highly encourage people to find a good strength and conditioning coach, or a good personal or PT or chiropractor, or somebody who's skilled in rehabilitation